Kelly, are you holding the baby?
Yes, I am.
Let me
Let me
see.
show you. You want to say?
Mm-hmm. Oh my gosh.
He's so tiny, huh?
No.
I know. I know. I bet Dr. Snyder's gonna be like, let me say that baby.
I'm sure.
Yeah.
We don't need to talk about HBG stuff. We just want to see the baby.
Are there? Okay, there I am. Yay.
Perfect.
Hi, Dr. Snyder.
Okay. Hello, everybody.
Dr. Snyder, do you want to see my new grandson?
Yes.
He's right here. Can you see him?
Yes. Oh, what a sweetie.
My daughter just had him last night at 7, a little after 7.
What?
Yeah,
Oh,
he's
I
not
didn't
here
even know she
24
was
hours.
pregnant, Kelly. I feel like we talk all the time. We're like business and personal
I
relationship over here. I
know.
didn't even know. Oh, congratulations.
Hey, before we get started, hey Rachel, do you listen to country?
Yes.
Okay, have you heard of a band called Country Twangy?
Mm-mm.
Well, I heard a song the other day called Smiling Bright, and it's really I want to play it for you. It's kind of crazy. I think you're gonna like it. It's real quick, and we'll start. You ready?
Down in a little town where the sun shines bright, there's a girl named Rachel with her smile so white. She's got a special talent, oh, you best believe. At dental practice valuation, she's the one you need. She walks into the office with a clipboard pen.
Oh my gosh.
Calculating numbers like a mathematical whiz. She knows the worth of every tooth, every dental chair. Rachel, you're beyond compare. She crunches all the numbers with a precise hand, evaluating practices in this small town land. She brings dreams to every dentist door. With her expertise and insight, they can't ask for more.
It's got a little ring to it.
Okay, so obviously that is not a real
Dr.
song.
Snyder's like, what the hell is that?
Welcome to this very special episode of Getting Down to Business. On today's show, we have our first case study of a successful dental practice transition. Joining us on the call today is Dr. Laura Snyder, DDS, who has purchased a dental practice with her husband in the last year. Working with the Hindley Burgmaier Group, and specifically our business broker consultant Kelly Yardman, Dr. Snyder is going to share her experiences before, during, and after the process of purchasing a dental practice of her own. It's going to be an exciting episode, so make sure you give it a thumbs up and subscribe to our YouTube channel so you never miss an episode. Let's get this episode started and let's get down to business.
Welcome to the Getting Down to Business podcast. We have our usual suspects, Kelly Yardman with her brand new grandson. We have
Jameson.
Rachel. What's that?
His name is Jameson.
Jameson. Welcome.
Yeah.
We have Rachel Robles, our valuation analyst, and joining us today is our very special guest, first of her kind. We get to actually interview a real life dentist who has successfully purchased a dental practice. Super exciting. So could you just start by telling us a little bit about yourself and how you got started with dentistry?
Sure. So in high school, I actually was more on a medical track. I took an advanced pre-med course my senior year of high school and shadowed with a second-year resident in pediatric at the time. And that shadowing showed me that medicine was not the direction I wanted to head. Working holidays, nights, being on call, very demanding. So at the time, my dentist was a female. And so I approached her and asked her how she liked dentistry. And she said she loved it and it gave a very good work-life balance. So I shadowed with her and really ended up liking dentistry. I, in high school, took a bunch of photography courses, art courses, And dentistry was a really nice blend of medicine and art and talking with patients. You have obviously more of a relationship with your patients than, say, medical doctors who may only see someone one time. So I really like that. I'm a social person. So yeah, dentistry at that point was something I was pursuing, and then applied to dental school and got into Marquette. So I went to Marquette in Milwaukee, Wisconsin
Okay.
from 06 and then graduated in 2010. So I've been practicing for 14 years at this point.
What motivated you to actually purchase your own dental practice? What was the journey there? You probably didn't just start out like buying a practice, right?
No, first practice I've ever owned.
Okay,
So
cool.
it's been a long road over the last 14 years, and I've probably done the entire gamut of everything you can think of. So during school, I actually had an Indian Health Service scholarship. So right out of school, I worked for the Indian Health Services. I was in a small town in northern New Mexico, Taos, New Mexico, and I was there for about a year. And then my husband actually decided he wanted to go back to dental school, and they didn't offer the courses he needed in Taos, so we moved down to Albuquerque so he could go to school. And I continued with another tribe down here through Indian Health Services, and then actually got relocated through IHS to Oregon and worked there for a couple years. And then after that, my husband got in dental school, so we moved to Arizona. I finished out my IHS contract, and then I was an associate at two separate practices in Arizona. One was in Sun City West, and it was a very high-end fee-for-service, very large practice. There were 3 doctors, 20 staff members.
Wow.
It's a very like $4 million practice. And then I worked at a smaller office about an hour north of Phoenix, and it was completely opposite, rural, very hometown, small. I was the only doctor there. And then I also taught at my husband's dental school as a faculty member while we were living there. And then during COVID, my husband got deployed. So when he got back, he got stuck overseas during COVID. So when he got back, we actually moved to Wisconsin for a job for him there. And I ended up getting, I took the National Health Service Corps loan repayment. So I ended up working in an FQHC in Wisconsin for about 7 months, finished that out, and then had a baby. And then I was home for 2 years with the baby. And then we moved back to New Mexico. And not only did I go back to work, but I bought a practice.
Talk about overachiever.
We're just someone who can't stay settled, I guess.
You and your husband own this practice together, right?
Correct. So we are co-owners, though I am the one who is here every day. He is here right now currently on Thursdays. He does have more of the advanced training in implant placement, endodontics, cosmetic cases, full mouth rehabilitation. So it's kind of nice. We have our own set of things that we like to do and kind of exceed in. So he is here Thursdays right now.
And you guys specialize in cosmetic dentistry, or are you more general, or are you a specialty, or?
Yes, we do everything here, and we do have some more advanced technology in the office. So he loves the cosmetic cases, as I said, the full mouth rehabilitation cases. He does use a surgically guided implant placement system, which is kind of different than a lot of providers that place implants. I love doing crown, bridge. We have a laser in the office, so we do laser preps for cavities, as well as sleep apnea treatments. Invisalign we offer. Brought on some new equipment for aesthetic stuff. So we do aesthetic as well as TMJ Botox in the office. And we do specialize also in TMJ and joint disorders.
How do you feel now that you've actually stepped into an ownership role?
So obviously there's been a lot of pros, but it has been a learning curve. I will say I'm glad I didn't do it right out of school because it allowed me many years to get the dentistry down. So I felt super comfortable with my dentistry. So owning a business seemed like the next step. And obviously, it's really nice owning a business because you're not restricted by other people telling you what you can and cannot do for patients, what materials to use, what courses, advanced courses you can take. So obviously, you have a lot of latitude to do what you want with your office, the procedures you want to do. I know when I was working for, say, like Indian Health Service or public health, they really wanted you to be a jack of all trades. So root canals personally are not my favorite thing to do. I don't feel as comfortable with them,
Uh-huh.
but you basically were having to do them because you were the only option. Same thing with very difficult surgical extractions. I did them for many years. Now that's something I don't have to worry about doing. If I think another specialist would be better, providing a better service for the patient. So I can kind of pick and choose what I love to do, hone in on my interests, and I don't have to feel pressured. Obviously, making your own business hours because I am a mom, and that's my role first and foremost. I love being a wife. I love my kids. So it's really nice that I don't have to be Monday through Friday, 8 to 5. I can, say, hey, ladies, my son has a baseball game. I need to leave early this day. Or I can come in on the weekends and catch up on work if that works better. So you definitely have a lot more flexibility.
Yeah, and it sounds like that flexibility is a result of all the years you spent honing your craft. So when you and your husband were deciding to, purchase a practice, what factors did you consider? And then I also want to segue into why exactly did you move back to Albuquerque? What made you choose Albuquerque? So a bit of a loaded question there, but
So moving back to Albuquerque was definitely all me. I'm from here originally, born and raised. My parents are here, family's here. And just with 2 young children, I really felt it was crucial that they had a relationship with their grandparents. My parents are very involved, very helpful. Yeah, I went to dental school in Wisconsin, so I thought I knew what it was about. But when I went back, it was a hard time to move at that point because of COVID.
Yeah.
So no one was really interacting. Everything was shut down. I think I had seasonal depression, and then on top of that, with a pregnancy, postpartum. So I just missed the sunshine. I missed my family. So we decided to move back to be closer to family. And as far as criteria in buying a practice, so there were quite a few things we're looking at, especially being a couple, because it is different having 2 dentists. So obviously you need a facility that can accommodate 2 dentists. You need to have a patient load that can support 2 doctors, which is why currently my husband is only here on Thursdays. So we're really trying to build up the practice, get our name out there,
okay.
because it was only one doctor prior, and she was plenty busy. Space, patient load. We wanted to see how long the staff had been employed at the practice, because long-term staff was really important to us. We just didn't want people that were moving around. We really wanted to create a dental home and an environment where the patients knew the faces when they walked in. Because I had worked at places where, the staff was rotating all the time. And it's difficult to build relationships with people. And I feel like for the patients, when they come in and they're always seeing a new face, they're wondering what's going on. They like that continuity of having the same people. We were looking at the types of procedures that were being done in the practice. Were they similar to what my husband and I were doing and felt comfortable doing? Was there room to bring on additional services that weren't being offered. So that would be a way to grow the practice. Obviously, we're looking at technology in the practice, what they were offering, how you practice dentistry, as far as there's dentists that say watch a bunch of things, like they'll put watches on everything. Or is the dentist more aggressive at treating? You have to have a similar practice style, I think, and able to make it work. Because if you and the previous owner that you're buying from, are very different, that can scare patients away as well. So are the patients well educated? Are they, as I said, told like, okay, this treatment's important and here's why it's important? Or is it, oh, we're just going to watch that and see, what it looks like in 6 months? So I'm very proactive, and so is my husband in our approach to dentistry. I would rather be proactive than reactive, because you have far fewer problems in the long run if you're a proactive dentist. So we were looking for someone that shared our philosophy and dental practicing style. Also, a fee-for-service practice was very appealing to us, so we didn't have to deal with the limitations of insurance and how that can influence patients to accept treatment or care. And I find that most patients that are very insurance driven, unfortunately, you're constantly chasing problems, because the insurance will dictate what you can and cannot treat, how often you can treat something. And so dental problems generally become greater and more expensive if they're solely focused on what their insurance will cover and pay for.
How did you end up working together with Eric and the Hindley Burgmaier Group?
Oh gosh, I think we've had a working relationship with Kelly for years before buying the practice. And I'm pretty sure my husband, well, when we were living in New Mexico years ago, I know we took a few courses at the office that they offered. So we were familiar with their services and what they did. And then I'm sure it was my husband who was looking for practices, and Burgmaier was the broker. But I'm sure Kelly, she's like, are you guys ever going to buy a practice? I mean, she's known us forever, several years.
So they did. They initially they attended some of the educational things that Eric would put on. Jeff, when Laura wanted to come back to New Mexico, Jeff started reaching out, looking at practices that we had listed, and so the relationship there just has been developing over the last few years. So
Kelly was sharing practices with you as far as like options. You settled on maybe you started to narrow it down. Can you walk us through, I guess, what due diligence steps did you find the most crucial in evaluating the practice?
So I think I touched on a few of the things previously. Like, obviously, when we were looking at a practice to buy, the size of the building was very important. Right. Number of patients, staff longevity. But some of the other things that we were focusing on, obviously, area and location. We wanted something centrally located in the city, in a nicer area, somewhere convenient to my kids' schools, their daycare, my parents. Whether the building was for sale at some point or currently was a big factor to own the real estate and not just have to perpetually rent. Obviously, we were looking at profit and loss of the practice and the profitability of the practice, the overhead, what the practice was running at, whether the overhead was super high, low, at a reasonable amount, if there were any room to decrease the overhead. Obviously, what the landlord would be charging for rent. And honestly, when you go to meet the doctors, just how do you feel in the space? Is it a comfortable space? Is it somewhere you'd want to be? How did you hit it off with the doctor? And I know this sounds really weird too, but there's a lot of practices where the doctors say they're ready to retire or they're looking to sell, but then honestly, in the end, they're not really ready to exit yet. So they'll put limitations like, oh, could you be an associate for 2 years? And then maybe by the second year, we can kind of talk about buying and I'll exit in, 5 years. Like we really needed something that we could hit the ground running with.
Yeah. So it sounds like you found one that was willing to just bow out gracefully and kind of just let you take over. Perfect.
Correct.
What would you say was some of or one of the biggest challenges that you faced during the purchase process?
I remember a practice that I worked at in Arizona. I had just started as an associate at this practice, and I'd only been there a few weeks, and then I found out that the practice was sold to a corporate dental place. And the owner that hired me obviously didn't say anything that he was looking to sell or this was a possibility. And I remember being a little shell-shocked. I didn't like the corporate model. I didn't have a very good relationship with the owner that took over and bought the practice. So I think that was really difficult navigating what to tell the staff, especially because I came on at first, and I know that they told the staff that I was kind of just here to observe and that maybe I would come on as an associate, but I felt, it's hard. It's hard. What information do you divulge? What do you not want to tell the staff? So that was difficult, knowing once they found out that I was taking over the practice, were they going to stay? Were they going to leave? Obviously, you have no idea how patients are going to respond to you. So that's always challenging, building those relationships, building rapport with patients that have been with the same dentist for many years. And of course, when you're first starting out, you hear, oh, how is, so-and-so doing? Or, oh, we had patients that would call when they found out that the practice had been sold. And they're like, well, I think I'm going to go somewhere else. And it's like, well, have you met her yet? Oh, no. But so that was always not taking that personal was difficult. The amount of work to transition ownership, I had no idea. So when I came on, I was here maybe a couple days, and the doctor was actually leaving for medical reasons, so she really couldn't practice dentistry. So I kind of went straight into patient care, and trying to navigate the business side of it was extremely overwhelming for the first several months. It felt like I just couldn't get ahead of it. Transferring over all of the accounts, figuring out how to get my small business license. I felt like I was in a fog for 2 months. I was always calling Kelly, asking for help. Like, how do I do this? Who do I need to call? How do I sign up for this? Yeah, so I wish I had known. I think if I could do that over, I would have definitely started on the business side of it prior to even coming into the office. Like, I would have worked with the owner outside and tried to get that all transitioned over prior to seeing patients, because it was a lot.
Yeah, some of the things you just touched on, especially like the staff, how you kind of have to come in a little bit under the radar almost and just kind of, you're kind of feeling the place out, you're getting a feel for the staff, the patients, yeah, that definitely seems like one of the bigger challenges. And then also, once you were in there, you're realizing, hey, I have a business to run here, not just going from, operatory to operatory and doing the stuff that comes naturally to me. There's a whole other element here that I'm maybe not accustomed to. Have you read Norton Hindley's book, Getting Down to Business?
No, I have not.
I think I'm going to get you a copy of it, because basically it talks about, the importance and really, you as the dentist, your wheelhouse is being around people, performing the work, right? That's second nature to you. But a lot of dentists, when it comes time to being the CEO of their business and the CFO, especially, I mean, of course you need help. You need, your accountants, you need people to do that stuff, but it really doesn't come naturally to them. So there's a great book. That's why we named our podcast after his book, Getting Down to Business. I'm going to bring you a copy. I think that you might find it very insightful, and it really talks about, not only being the dentist that does the work in the rooms, but being the CFO and being the CEO of your business. I think it'd be a great book for you and your husband to check out. So yeah.
I was thinking that would be nice because they teach you the dentistry and dental school. They don't teach you anything about business.
Yeah, this is all about the business side, and it's written by Norton Hindley, who worked with hundreds of dentists, I'm sure, and had an extremely successful career, with transitions and helping dentists, and has worked with big names and everything. I think you'll get a lot out of it. Okay. You mentioned Kelly. It sounds like she was influential in helping you overcome some of these challenges. What resources, you mentioned Kelly, were there any others that you found helpful in overcoming these challenges?
Obviously, finding a good attorney to help you look through the purchase agreement, lease agreement. I'm trying to think. Honestly, I blew up Kelly's phone all the time. I would think I say she's probably, and I actually have a lot of friends who are dentists, similar age. Some own their practices, some don't. Obviously, I talked to them a little bit about what they did. I actually currently still am working with a consultant. So she helps with more of like the HR staff things. We have a monthly call. She, goes over budget and job descriptions for the staff and what our goals are and where we need to be and how to talk to patients. So oftentimes on our weekly huddles, we'll incorporate things that she's advised us to do, like how to speak to patients. So that was, I've actually reached out to her quite a bit as well, the consultant, for help and, what kind of document do I need, or how do I find this? Those
Absolutely.
are probably the people I've reached out to the most. And then the previous owner, I mean, I try and pick her brain.
You threw out two words there that I'm going to touch on, attorneys, and then a little bit about financial stuff. So was there any financial planning that you had to undertake before and after purchasing your practice?
Well, as far as financial planning, obviously we just had to work with a bank, get approved through the bank. But the consultant has been probably the person that's helped me most with the financial plan. So she actually worked with another lady that I connected with, and she came up with an entire annual budget. So we had to send sheets for everything we spent in the office, an idea of where production and collections were, what the practice had in the past been producing. They ask for your student loans, your car payments, and mortgage, anything like that. The loan on the building, how quickly you have to pay that off. And then really she came up with an entire spreadsheet. How many days a year are you working? How many days do you plan on taking off? And basically it's, the budget of how much you need to be producing as a dentist per hour, or your monthly goals that you need to hit in order to keep the business running. And my big thing, both my husband's and my goal obviously would be to pay off our student loans. So that was a big factor in the budget and financial planning.
Yep. Sounds like you did and are doing a thorough analysis of all those key points. And then as far as the legal aspects, did you encounter any unexpected hurdles?
Well, initially we used him for the APA, as I said, the lease agreement. One of the previous employees, I will say that she had a very close relationship with the previous owner and constantly was bringing up how she felt hurt and upset that she didn't know about it. And there was a little issue with her, and I will say the previous owner. So I had to reach out to the attorney in that regard. So yeah, I guess you never know when you're going to need them. And it's so important to make sure when you read the APA to really understand what you're reading, know, the terms, limitations, all the fine print, what's in there, because you never know when you're going to run into a situation that you may need to refer back to that. So yeah, that's been the only thing. Overall, things have been pretty smooth, and I really haven't had to speak with the attorney, which is great. So
Yeah, that sounds good. We like that. Okay, let's talk a little bit about what it's like running the practice with your husband. Is this the first time you've run it together, or have you guys worked together in the past? Sorry, I forgot.
we've never worked together prior to this.
Okay, what's that like? How do you
I
divide?
actually
How do you
really
divide the
like it.
responsibilities? You guys
So
have.
I definitely have the full responsibility of running the business. So all of the paperwork, the business side has been solely me, because I said he works at another practice 3 days a week currently. So that's been all me. Though I will say he's been very handy and helpful in coming in and fixing things and redecorating and reorganizing and just doing the handyman stuff, which has been awesome. So he's helping me a lot in that regard to get the practice just a little facelift. But I mean, I love working with my husband. I've worked in obviously several jobs prior where there was a lot of camaraderie and you could bounce ideas off of other doctors. And so I really like that. I like having him here because we can help each other out. We can, if one of us is running behind, we can, go see the exam. Plus, as I said, he does more of the advanced procedures that I don't necessarily have an interest in doing. So he's able to come in and do those for the patient, which is really nice because a lot of our patients prefer to stay in-house if they don't have to go to a specialist because they're familiar with the building and the staff and they're comfortable here. Like I said, anytime you get another doctor involved, it's a little more difficult to correspond or know where the treatment is, where he and I can sit down and it's like he can tell me exactly where what step he's at, where the process is. So the continuity of care I think is a lot more seamless in there than if we're referring out to several other specialists. Plus I know he's going to do a good job. We're both really good at what we do and we're passionate about it. We care about the patients and we just have very similar practice styles and philosophies. So it's been really nice.
Are there any tips that you would give other couples that are looking to go into business together? Any advice?
Well, they always say, don't bring work home, but that's difficult to do. I think there has to be a clear understanding of the roles. So we were very clear on, although we jointly own the practice, as I said, I am here 4 days a week. The majority of the time I run the staff meetings, I pay the bills, I write the checks, almost everything's in my name, and he's okay with that. And he knows he comes in and does the procedures he wants to do. You just have to have boundaries and you need to set expectations. So I can't ever go to him and be like, well, why didn't you help me, pay this bill or do this? Because I know he's at his other job doing that 3 days a week. I feel like that could be a problem if you didn't have those expectations set up prior. The other thing too is you have to be understanding. The one difficult thing is, say a patient got upset because your husband did something and you as the wife and the business owner, it's hard to be like, well, oh, I don't want that patient leaving the practice, or what did you do? But you've got to be supportive. That can be difficult. Like I said, you just have to really support each other and appreciate both roles you play in the office. But it can be hard. Obviously being married and seeing each other all the time and then being in the office. And as I said, I brought in an aesthetic machine and I know I was super excited about it because for me, dentistry I've been doing for so long, I needed something else to get excited about, something to train on. And I know for him, he didn't understand the value in aesthetics or things outside of the mouth. So that was, I had to convince him, like, no, I did my research. This is something I'm really interested in. I want to be offering these services. But I know he was pretty upset because for him it was, well, are you a dentist or are you an esthetician? Or, like, aren't you just happy doing dentistry? So, I mean, there's always a few things like you have to be open, communication has to be there.
Were there any changes that you implemented when you took over right away?
No, I really tried to keep things the same for the continuity of care because that's one thing I didn't want to do was patients leaving. Though it was interesting, I feel like even after I took over and we kept telling patients things have remained the same, nothing has changed, we still have patients under the impression that somehow something was different or had changed even though it did not. Like just now, and I've owned the practice for, gosh, I guess eight months, so roughly maybe around 8 months. I'm just now starting to kind of branch out, do my own thing, and make it more of my practice. But initially, I really didn't change anything. We kept it all the same. The only problem I know that kind of threw patients off was transferring my name to patients that had insurance. That's been a problem with the insurance companies for the out-of-network providers because we are out-of-network provider. The patients were not receiving their reimbursements as quickly, and that has been a big challenge. So that was one thing we really had to discuss with patients, like it's been submitted, we're calling them, we're working on it, you will get reimbursed, but according, of course, to the patient, I was like, well, with the previous owner, I got my check in the mail right away, and why is this taking so long? So, I mean, there's always going to be hiccups and things that are going to challenge you, even when you try and keep everything the same.
Would you give just some advice just to somebody that's like basically doing this for the first time themselves? And, their question for you is, how do you manage patient retention during the transition?
So the previous owner, she and I drafted up a letter before her departure, basically introducing me, and was supposed to be a letter of goodwill and support. So we sent that out to all the patients. We did a magazine ad in the Albuquerque magazine with the two of us. Also, just showing her supporting me, taking over, that, I was handpicked by her. I was the perfect fit. I was going to run the practice just the same way. But honestly, I think the staff is the biggest component. I mean, you have to have a staff that, and although they didn't know me, I treated them well. I leaned on them for advice and support, and they were really crucial in talking to patients about how I said nothing had changed. The continuity of care was there, same philosophy. They were going to still be treated the same way they always had been, and they really talked me up and supported me. And if patients have been going to a place for a long time and they know the staff, they're going to trust the staff.
Looking ahead, now that you've settled into your new practice, it's been about 8 months, a year will be here before you know it. What would you say are your long-term goals?
So obviously long-term goals would be to continue growing. I think eventually my husband and I would like to both be at the same office practicing together full-time. So increasing the patient base, possibly eventually maybe even, moving into a bigger space that accommodates both of us. I said I just bought that brand new aesthetic machine, and I'm considering maybe purchasing some others. So bringing on a component of the aesthetic and like medical spa or dental spa portion more. Just keeping patients really happy, staff really happy, just doing the best we can and growing. I think that's the biggest measure of success is if you're growing.
Absolutely.
Because obviously then people are referring their friends and family and other patients to you. Obviously Google reviews are a big thing.
Big
So
one.
just really growing the patients. And, bringing in newer technology, keeping up with the latest and greatest as far as taking continuing education and really being knowledgeable and offering some treatments that, maybe other dentists in the area aren't offering, like I said, our laser, sleep apnea. So really keeping up with the newest technology and research is big for us as well.
What advice would you give to other dentists considering buying a practice?
First and foremost, I would say make sure you feel comfortable with your dentistry. Second of all, really be prepared for being a business owner and the responsibility that comes with that. So maybe take a business course or talk with someone, have someone like Kelly that can help you and guide you through all that. Now you have a staff depending on you. I've always worked at places where I was the staff. I just got a regular paycheck, went home. I didn't have everything else to worry about. And now it's people are dependent on me. They need to get paid. We need to be productive. So I would say just really knowing what you're getting into with buying a business. So have your dentistry down first. Decide what kind of practice you want and look for that kind of practice. Like, I'm so glad I didn't buy, extremely large, like DSO model practice. It's taking a bunch of insurances. Like, you have to know what fits your lifestyle, your philosophy, the model you're looking for, because that way you're going to be successful and happy.
Absolutely. Okay, last question. What do you wish you'd known before starting this transition process?
Just how much work the first few months would be. Because as I said, if I could have done it over, I would have started on transitioning over accounts and learning the business side prior to patient care. Because it was very overwhelming and a lot at the beginning. And the other thing too is, you have to, well, maybe it was because I was off for 2 years taking care of a baby and then just kind of thrown back into everything. So it's very overwhelming. I really wish, I would have focused on the business side and getting that all wrapped up and taken care of prior to coming in and doing patient care.
Yeah, I really think Norton Hindley's book, Getting Down to Business, would help you and will still help you. So I'll definitely be dropping you off a copy as a thank you for being on our show. We really enjoyed having you. I hope it was interesting for you to share your experiences. I think that it'll help other dentists. We usually, we publish these clips on YouTube, and we have an audio RSS feed that we're growing. So, do you have a LinkedIn? How do people find you? What's the best way to, to contact you and find your services?
So I do not have a LinkedIn. But the office has a Facebook account and an Instagram account, and we're in the process of changing the name. So we just got a brand new website up. So the new name of the practice is going to be City View Dental Studio.
City View
love
Dental
that.
Studio. Okay.
Studio.
Yeah, awesome. Well, how exciting. I really hope that we can, have you on in another year just to kind of update everybody on how things are going. And
That'd be great.
We really appreciate your time. Dr. Snyder, say hello to your husband for us, and we'll see you. We'll see you when we see you. So,
Yeah. I'm sure I'll
awesome.
be calling Kelly in like 2 days. So
Yeah, that's great.
congratulations, Kelly, again.
Thanks, guys. And yeah, Laura, I'll be talking to you probably kind of soon in a couple days.
Okay.
Yeah.
Awesome.
Cool.
Well, thanks, guys. I'll see you guys later.
Okay.
Thank you, everybody. Have a good rest of your day.
Thanks for tuning in to Getting Down to Business. We hope you found this episode insightful and useful to your practice. And if you're considering purchasing or selling a dental practice, be sure to visit our website, www.hindleyburgmaiergroup.com, to schedule a consultation with Kelly Yardman. And also be sure to check out our amazing book, Getting Down to Business, available on Amazon. Just check the link in the description for more information. We look forward to hearing from you, and we would love to get your feedback on topics of interest for upcoming episodes. We will see you next time.